Breaking news! Newly discovered research shows that 80% of opioids are consumed by Americans. Now Christine is going to go more into detail about how these narcotics are being abused.
With the advances in medical technology in 2019, there are many more opiates and narcotics out in the world, but the most commonly known are fentanyl, heroin, oxycodone, and morphine. Fentanyl is commonly known as China Girl, Phenny, Patch, Goodfella, and it's similar to morphine, but it's 50 to 10 times stronger than morphine, and it's commonly absorbed through the skin or by sprays, and they can be taken by tablets or even injection, and commonly there are overdoses. Heroin is also very common. It can be known as horse, black tar, black pearl, or M. It's known to come in brown or white powder, black or sticky substance, and it's commonly injected. It can also be snorted. Oxycodone, also known as Oxy, Big O, or Auntie, is another painkiller, and it usually comes in the form of pills. And more often than not, they are medically prescribed by a doctor after a surgery or any operation or situation where somebody had large amounts of pain. Morphine is another medically used drug. It's also known as M, the Red Rocket, and it usually comes in forms of tablets, oral solutions, or even injection. Even though I just touched on only a few of the narcotics that are in the wrong hands, however, there are many, many more in this time and age, and it's something to look into.
There are many short-term and long-term effects to narcotics. Some short-term effects may be dry mouth, fatigue, altering between alertness and drowsiness, impaired mental function, constipation. Some long-term effects may be a suppressed immune system leading to frequent infections and possible heart and liver problems. Symptoms that include possible infertility, anxiety, loss of muscle strength and mass, and irregular menstrual periods. Painkillers cause the disruption of production of dopamine, causing one to rely on the painkillers to make the pain go away. So I decided to do a Q&A on Instagram for people who were wondering any questions on how to find if people are becoming addicted to any type of drugs or how to treat them, anything like that. So I'm going to be reading off some of these questions and giving you guys answers. Shaniqua from New York City asked me, how do I know if one starts to depend on a drug? Well, let me tell you. When people start to become dependent on drugs, it becomes very obvious that they spend all of their time thinking about buying new drugs, getting some more, smoking them, just they want to dedicate all of their time to this specific drug. It may start leading to thoughts of suicide or becoming very depressed. People start to become a lot less interested in their hygiene and what their personal appearance looks like, and a lot of people might start losing possible large amounts of weight loss. Peggy Garnish from Massachusetts was wondering what the best way to treat an addiction is. There are two types of ways that you can treat an addiction. One is a pharmacological treatment, which is more like treating an addiction by medication and pills. Or you can go through behavioral treatment, which is more of a therapy type of treatment. Both of these treatments help improve brain function and behavior, which have actually been proven to result in increased employment rates and lower the risk of criminal behavior and diseases. The most effective way to use both of these treatments is when they are combined together, meaning using the medication and therapy at the same time. That has been known to create the best results in treating an addiction. Lofexidine is actually a non-opioid medication which has been approved by the FDA to help treat a narcotic condition. The therapy helps in ways by changing a patient's expectations and behavior related to a specific drug use. Jessica from Washington is asking, how do I know if I'm having withdrawal symptoms? Well, some commonly known withdrawal symptoms of opioid addiction is things like pain, diarrhea, and vomiting. There are medications you can get to help reduce toxins in your body that can cause things like this. Detoxifying your body may help decrease a lot of these withdrawal symptoms, but it is not a treatment itself. It is only known as a first step in a treatment to narcotic addiction. Now on to Amber with an interview of a patient from the Hazelden Rehab Facility.
Okay, boom.
Thanks, guys, for that quick background information. Now I will be interviewing a recently admitted patient from Hazelton Rehab Facility. Hello, what's your name?
Simone Thompson.
What drug are you currently trying to overcome?
Black tar heroin.
What feelings did you have to make you continue using the drug?
A warmth. Like myself. Didn't have to worry about anything.
Have you tried to quit before?
When I became pregnant with my first child.
What's your body experiencing right now?
A pain, an ache. I feel like I have no control of it.
When were you admitted to this facility?
I think less than 2 days ago. My first night was last night.
What are your final goals at the end of this treatment?
To go home to my children and raise them to be everything I'm not. And give them a good life.
Well, I wish you the best of luck. Thank you.
Thank you.
Thank you for tuning in with our guest star, Simone Thompson.